Hello friends, so in this video I am going to discuss about the osteology of the first cervical vertebra, or it is also known as atlas. According to Greek mythology, Atlas is the god who supported the earth on his shoulder. So on his name Atlas, the first cervical vertebra is named as Atlas because it supports the skull. Now, how I can identify that this vertebra which I am holding in my hand is the first cervical vertebra. So, I mean to say what are the distinguishing features of the first cervical vertebra. First of all, you can see this vertebra is the shape of the this vertebra is ring shaped, okay, and it has no body and no spine. It has no body and no spine. It has two lateral masses on each side. You can see this is the lateral mass on each side. It has two arches. This is the anterior arch and this is the posterior arch, and these are the two transverse process which has foramen transversarium. Here you can see this is the foramen transversarium. Okay, so these are the identifying features of the first cervical vertebra. So it is ring shape. The shape of the first cervical vertebra is ring shape. It has two arches, anterior arch and a posterior arch. The anterior arch is smaller, posterior arch is larger. It has two lateral mass on each side, and this is the transverse process in which you can see this is foramen transversarium. So these are the it has no body and no spine. First of all, what you have to know is the shape. The shape of the first cervical vertebra is ring shape. It has no body, no spine, and it has two arches, anterior arch and a posterior arch. It has two lateral masses. You can see this is one lateral mass on one side and the other lateral mass on the other side, and it has transverse process in which you can see the foramen transversarium is present. Now, how to hold this vertebra, first cervical vertebra, in anatomical position? I can hold it like this also, I can hold it like this also, I can hold it like this also. But which position is the correct position? For placing this vertebra in anatomical position, there are some points which we should keep in mind. The first point is the two arches, the anterior arch and the posterior arch, should lie in the same horizontal plane. Then the anterior arch is smaller than the posterior arch. Okay. And the third point is that this superior articular facet, here you can see on the lateral mass there is articular facet here. This articular facet will articulate with the occipital condyle, and again here inferiorly there is another articular facet. You can see this articular facet will articulate with the superior articular facet of the second cervical vertebra. Now, for placing this vertebra, the first cervical vertebra, in anatomical position, you should know that the superior articular facet is elongated and the inferior articular facet is almost oval. You can see here this is almost oval, and here you can see this is superior articular facet is elongated. So there are 3 points which we should keep in mind for placing this first cervical vertebra in anatomical position. First, the two arches, the anterior arch and a posterior arch, should lie in the same horizontal plane. The second point is the anterior arch is smaller than the posterior arch, so we have to keep this anterior arch anteriorly and posterior arch posteriorly. The third point is that the superior articular facet on the lateral mass is elongated. It is elongated, so we have to keep this articular facet superiorly. I can keep it like this also, but this is wrong because this articular facet is almost oval. So this is the inferior articular facet, and the superior articular facet is elongated, so it should be placed superiorly. So this is the anatomical position of the first cervical vertebra. So in this video, I have discussed about the distinguishing features of the first cervical vertebra and the normal anatomical position of the first cervical vertebra. Thank you.